So on the sheep brain, as I said, first examine it this way. Make sure that you see it from every angle. From here, these are the cerebral hemispheres, two hemispheres that they're connected here on top. If I open it up, you're going to see the diencephalon brainstem. This is the brainstem down here. You can see the cerebellum, and diencephalon is in there. So it's actually, right now, we got to cut it to see a better view of it. So looking at it from this angle, from the ventral angle, you're going to be able to see the cranial nerves. A couple of them actually you can see here. This little top part, which is kind of round, it's olfactory bulb. And then, so this is, in humans, we have the pretty much similar things, much smaller. There's pretty much similar thing that sits on the ethmoid bone. Remember the cribriform plate, all those little foramina? So the olfactory nerves take the information, smell information up through those holes to these guys. And of course, they take it straight to the brain. So this is the cranial nerve number 1. The cranial nerves, you have 12 of them, right? 12 pairs. They're numbered from top all the way to the bottom. So they go in this order. As you can see in a sheep brain, not many of them could be seen because the dura mater from the top, the meninges, is removed. And that's why you can't see it, because these nerves, they look like rubber bands. Once it's disconnected, it pulls back, you can't really find them. So this is number 1. Number 2, it's optic nerve. So you can see this little structure here, like a cross structure. This is called the optic chiasm, or your book calls it chiasma. So optic chiasm or chiasma, same structures right down here, where this is one nerve, goes this way to one eye, this another nerve goes to another eye, but this is cut off here. So coming down here, I can see a remnant of dura mater here, a little bit. It looks like a little white tissue here. That's the dura mater, and this is your pituitary gland, which normally it's not there. Normally it comes off when you take the dura mater off. So if I want to take this off, notice that there are some nerves down there, kind of stretches while I'm trying to pull. See that? That's basically what happens to the cranial nerves. They pretty much get cut off. So I'm going to try to take it off without. This is the pituitary gland, which connects to hypothalamus. And you know what it does, right? That's the master, pretty much along with the hypothalamus, they both control pretty much the endocrine system, all your hormones. So the pituitary secretes about 9 hormones, and all these hormones tell the other glands what to do. So for instance, the adrenal gland, the thyroid, the testes, the ovaries, all of these things are under this control of this guy. And this guy is under the control of hypothalamus. So you can see their relationship, how they work. So this here is your trigeminal nerve. It's going to be big, as you can see. This is the one that actually innervates the face. You go to the doctor, tooth pain, whatever, they have to numb that nerve, particular nerve, because it innervates the facial region, branches off to 3 distinct routes. So this is actually the number 5, the cranial nerve number 5. So we got number 1, we got number 2, got number 5, because 3 and 4, they're going to be down there, and we're going to try to find them if we can. So I'm going to go ahead and remove this. So in some of the brains, you might not see the trigeminal like this. You might see just a little end of it. It's going to look like that. I'm putting my finger in here, you're going to see something like that. So you know the general location of the trigeminal and general size. Pretty much it's the same.
Right here.
So this would be number 5.
Looks like it's coming out of the brainstem.
Correct, and that is. So if I try to slowly get off. Oops. It'll help if you cut it right, too.
It's kind of old school. You know, we have scalpels.
I don't have one right now with me, so I'm sorry. I'm trying to not to damage this. So this one here, this is your 3rd nerve, which is what? So we got the optic, oculomotor, number 3. So we got number 1, olfactory, optic, oculomotor, and number 4, which is the pretty much general location, looks like this one here. See this little tiny one coming from the back, trochlear, number 4, comes from the back, just like that. That's your nerve number 4, trochlear. We got the trigeminal already, and the abducens is going to be The abducens, general location for abducens is here. We have to clean this in order to be able to see it. I don't even know if you're going to be able to see it because of the, you might have damaged it. Is this the nerve? Yeah. There. That would be your abducens. It's pretty much general location. So you got 6.
So is that on the top of the medulla
Pretty much.
oblongata?
It's located, correct. It's located medially to the trigeminal nerves.
Medial to trigeminal.
Yeah. So you're going to have 2 of them actually. And some of these, you see it here right now, but once you go look at your brains, you might find them. You might find some of these nerves. You might not find them. It's possible. So it's absolutely okay because, like I said, sometimes in the process of removing dura mater, they damage those. So let's see what else. And then when you examine, once you're done with that, so we already know, we looked at some of the structures there, and the pons and the medulla down here, pons and medulla and spinal cord. And the spinal cord, if some of the spinal cord, you can actually see the gray matter and the white matter. I don't know if you've studied the lateral horn, ventral horn, all that stuff, not yet. So if you do study that, you'll see it. It looks like a little butterfly in the center of the spinal cord. So that on this one, I don't quite see it, but some of them might be very tiny, but you can't see it. That's the spinal cord. Now, once you're done with that, then look inside what I was telling you about. This is the cerebellum. If you hold the cerebellum down this way, do you see the pineal body? Pineal body is this one down here, that little structure there. This one, or pineal gland. Do you see it there? You folks see it there? That one?
What?
That little gland, or it's called pineal body or pineal gland. This is the one that produces the melatonin hormone, sleep-wake cycle, circadian rhythm. This is the one that's involved in that. Now, these 2 structures here, this one and that one. So let me show you one more time. One here, it's called the superior caliculi. The other one, they look like 4 butts sitting on top of each other. Actually, 2 butts sitting on top of each other. So this is one, this is another one. This would be superior caliculi. This would be the inferior caliculi. This is involved in visual reflex, and this is involved in hearing reflex. So they both are involved in some sort of visual and auditory reflexes. So like we call it startle reflex. When some loud noise you hear, you quickly turn your head. These guys are involved. So once you look at it here, you see the pineal body, you see these 2 structures. Pretty much you're done examining the brain, the ventral aspect of it, or the superior aspect of it. Once you're done with that, then give me sagittal section. So since this is a good brain, I'm going to keep this because we have all the nerves pretty much in here. If you want to give me that brain, I can actually sagittally dissect that one, unless you want to, you have special